Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is November 6th, 2020. As always, we'll start with our COVID-19 statistics. Worldwide, we have over 49.5 million cases and over 1.2 million deaths. In the United States, we have over 10 million cases and over 241,000 deaths. In addition to the normal statistics, another number we'll share this week is over 100,000 new cases per day for multiple days this past week. In fact, yesterday there were around 120,000 new cases. It's by far the highest number of cases per day we've seen in the United States. While some counties and individual cities may be seeing some decreases, the United States overall daily cases are increasing at record rates. Canada is also now seeing a surge in cases about 3 weeks after their Thanksgiving holiday. Public health experts in the United States warn that we could also see a surge after our Thanksgiving holiday if the CDC guidelines are not followed. We mentioned those CDC guidelines for Thanksgiving a few reports back, so feel free to check that out. We know that seeing family around this time of year is important, but please be cautious. If you can do it virtually, that would be the safest. A new study shows that if a person has been infected with the coronavirus, household members are likely to catch it too, as we've assumed for quite some time now. Typically, household members become infected within just a few days of the original person getting it. Isolating the sick family member when possible and having everyone wear face masks can reduce the chance that other family members become sick. Studies of pregnant women with COVID-19 have shown a slightly higher percentage of preterm births. Past studies have also shown that women who are pregnant have a higher risk of complications from COVID-19. A number of new, faster tests for COVID-19 are in development right now. Once they're available, we should have much better access to accurate test results in less than 30 minutes. A newer vaccine that's still in phase 1 trials has shown a much higher level of antibodies than other vaccines. Since it's only starting phase 1, it will be a while before it becomes available. But if the antibody levels stay consistent and it's proven safe, this vaccine could end up being the go-to vaccine in the future. A new computer program can determine if a person has COVID-19 just from listening to a cough. If a person is asymptomatic, they can just force a cough and the program can still tell with high accuracy if they have COVID-19. COVID-19 changes the tissues in the throat, mouth, vocal folds, and nose in such a way that even if humans can't tell the difference, this computer program can. It changes how it sounds. As soon as it becomes available on smartphones, which is their end game here, they're wanting to get it out on smartphones, it could be another big ally in the fight against COVID-19. So enough about COVID-19 for this week. This week there wasn't a whole lot of news about it, just because the biggest news this week was really the election in the United States. It was all over. It's still going, even though the election was on Tuesday. It's now Friday. We still don't know who's president. That's just been the news. So here at Plain English Public Health, we strive to be politically neutral in our reports. We believe that people's health should not be politicized. Good health is something we all need, regardless of our political beliefs. We also recognize that all political parties have both good and bad ideas concerning public health. Our purpose as public health professionals is to determine what the best ways are to keep people healthy and to then educate and encourage. So, there are many aspects to public health, including physical health, mental health, poverty, education, and so forth. One topic that we deal with all the time, but unfortunately don't talk about as much as we really should, is health disparities. Health disparities are differences in health or healthcare due to any number of causes. Some of the most common causes of health disparities are race or ethnicity, socioeconomic status, education level, geographic location, gender, age, and others. The opposite of health disparity is health equity. Health equity means that everyone has the opportunity to be as healthy as possible. Some disparities can't be changed. For example, there are genetic differences that cause or contribute to certain diseases, And our technology at this point just isn't good enough to go in and remove or repair those bad genes. Maybe in the future it will be. But for many, many other causes of health disparities, we can do quite a bit. And that's what public health aims to do. That's one of our biggest things that we do. So this past year has given us all many good examples of why it's important to find ways to overcome health disparities and strive for health equity. Just one example is that we've seen more people becoming infected with COVID-19 who are at a lower socioeconomic status than those who are better off financially. The main cause of that is that they are working in jobs that require more face-to-face time with others, the so-called service professions. Along the same lines, minorities, especially African Americans, are more likely to catch COVID-19 because they are more likely to be in that lower socioeconomic tier. So this is something that's been an issue in the United States for quite some time. We've seen some of that racial tension come to a head this year, not necessarily because of COVID, though I'm sure that had some to do with it. There were a lot of other reasons for the racial tension this year. There's a lot more under the surface still that just hasn't come out. Regardless of who wins the election, whether for president, Senate, House, or something more local, we need to heal our nation. Whoever becomes our leaders, they need to focus on healing our nation and getting rid of these health disparities. The United States was built on the principle of unity despite differences. We're meant to be a melting pot of cultures where we become a unified nation by accepting each other's differences and joining our cultures together. We shouldn't shun those who are different than us. We should come together as families, neighborhoods, communities, and as a nation to figure out the best way to help everyone thrive. Avoid an us versus them mentality, and instead try to understand others. Put yourself in their feet or in their shoes. In many instances, the differences we see will be the keys in solving our problems as we seek compromise and agreement. If we're all working together to overcome health and other disparities, seemingly impossible problems such as access to healthcare, poverty, and racism will be easily beaten. It may seem like a pipe dream right now, but it has to start somewhere. Each of us can start the change. Thank you for watching the Plain English Public Health Weekly Report for November 6th, 2020. As always, there are links below the video so you can check out more information about what we talked about and even some things we didn't talk about. I'm Richard Greenland, and you have a healthy weekend.